Good afternoon, everyone present here. I am Faraz from IJCP. Welcome all the participants on today's webinar. And let's welcome our speaker with great honor, none other than Dr. Ankur Kumar Tanwar sir. And let me share some of the achievement of sir. Sir has done BMS, MD in Ayurvedic Physiology, Assistant Professor of Kriyaya Shir Department, Raj Shri Ayurvedic Medical College and Hospital, Bareilly. And today, sir is going to discuss on a topic, very important topic, male infertility case studies in Ayurveda. To know more about this topic, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Uh, thank you, Froji, for inviting me. Thank you, IGCP, for inviting me for the webinar. The topic of my presentation today is male infertility case study in Ayurveda. It is the emerging topic nowadays, and its prevalence is enhancing in Delhi like city so much. All over India, its prevalence is so much increasing due to so many factors, so many stress, so many pollution factors, etc. So we proceed with the slides. We start from the introduction and talk about two of my cases of male infertility. One is oligospermia and other one is erectile dysfunction. The two emerging topic of the male infertility issue. So start from the introduction. Ayurveda, through its words in Chikitsa Sthan in Charak Samhita, Priti Balam, Sukham Vriti, Vistaro, Viplam Kulam, Yasho Loka Sukudka, Tushti Chapate Sanshita. Ayurveda, through its words, describe the importance of male reproductive health, the importance of reproductive health of male and female both. He Ayurveda described that the pleasure, strength, happiness, livelihood, expansion, family size, fame, happiness, and sustainability. All of this depend upon the progeny and the child. Our Upanishad also describe Putreshna as a chief desire of a life. They are the Praneshna, Dhaneshna, or Kameshna. Also, there is a Putreshna, desire of a child. Acharya Chakmani mentioned in new terms, Kameshna. Kam means sexual indulgence, which has procreation aspect like pleasure and recreation aspect like fulfill the desire of a child or healthy progeny. What is infertility? So, infertility is a disease of a reproductive system defined by failure to achieve a clinical pregnancy after 12 months or more of a regular, unprotected sexual intercourse. What about the statistics of infertility? Estimated 70 million people worldwide affected by the infertility issue. It is the main issue of concern worldwide nowadays, and its incidence varies from area to area with an average of 5%. The WHO mentioned that 9% of the couples worldwide struggle with fertility issue, and the male factor contribute to 50% of the cases. As per WHO, one in every four couples in developing countries have been found to be affected by infertility issue. In India, this ratio is 1 in every 6 couples. As per WHO, the overall prevalence of primary infertility in India is about 3.9 to 16.8%. What is primary and secondary infertility? Primary infertility is the cases of infertility which the couple unable to conceive. And in secondary infertility, the couples conceive previously, but now it is unable to conceive. So it is secondary infertility. Now, why I choose that topic? In my MD, I also work on the main fertility issue, oligospermia. And the reason behind to choose that topic is that the India fertility rate recorded under 2 in 2021, down from 6.2 in 1950. It is the report published in 2021. And the second report, which shows that the India couples are struggling to conceive. Why is the world most populous nation facing these challenges? Both these the cuttings and the blocks show that the fertility rates of India is declining, and the reason behind it is so many factors. And as a doctor, as a Ayurveda consultant, it's my duty to tackle this problem with the holistic way of life. So, what are the factors behind fertility? There are so many factors, but I concise few of the factors which are sedentary lifestyle. Sedentary lifestyle lead to the overweight and the obesity, which hamper the balance of hormones. Jaw pressure and stress. Stress causes the increased level of cortisols, the stress hormone, which hamper the quality and the quantity of semen in the ovum and cause the hormonal imbalance in the fertile couple. Faulty food habits. Faulty food habit also become a most common reason for the decline quality and quantity of sperms. These food habits lead to the decreased level of testosterone, decreased level of FHH and LH, enhancing level of prolactins. And in females, it causes the PCOD issues, the hormonal imbalance issue, uh, early menarche, early menopause issues. Environmental vehicle pollution. In Delhi like city, environmental vehicle pollution is the main contributing factor behind the main infertility issue. This environmental factor uh, uh, impair the hormones, causing the declining sperm quality, declining sperm mortality, decreased sperm count, and the decreased semen volumes. Postponing parenthood. It is the most prevailing issue nowadays. The couples, due to career and the financial consideration, due to birth control, cause the postponing the parenthood of them, which cause the decreased reproductive health in males, especially as the age incline, the reproductive health is declining. So it is the main issue nowadays for the increased issue of infertility. So what are the factors? What are the impact of infertility issue? The infertility obscure the most intimate relationship, physically and the mentally, between the husband and wife. This lead to the blame games. The infertile couples obscure from the family function and the religious ritual, which lead to increased level of stress, and the expectation of them rise, which again cause a vicious cycle of infertility and stress. Male infertility. As the figures shown by me, it shows that the male is 30 to 40% in cases, male factor is involved, and 40 to 50% of the cases, female factor is involved. And in about 10% of the cases, both factors are involved. So, in about half of the cases, male factor is involved. But due to social stigma, male partner is considered as secondary in infertility and most often untreated and undiagnosed. In a country like India, it is the most common issue. But really, the social stigma is enhancing so much. So the male factor is considered as secondary in infertility issue. How big is the problem? These are few are the newspaper cuttings which I show here there. Air pollution linked to declining male fertility. Male fertility, busy lifestyle, raise the fertility challenges. How men damage sperms could play significant role in recurrent miscarriage. There is a crisis in male fertility, but you would not know it from the way many men behave. In almost 50% of the infertility cases, the reason is male infertility. Bridge clinics warns of rise in male fertility issue. Weak sperms is one of the cause of the miscarriage that mother may not know about. So, when the couple fail to conceive, it is often regarded as a woman problem. But this is far from the reality. All these cuttings show that the male partner is also contributing significantly in the issue. What are the causes of male infertility according to Ayurveda? Anatomical, there are four main causes. Beej Upghajanya. Beej Upghajanya means anatomical and abnormality of the sperms due to genetic factor. Shukrashajanya, deficiency of the seminal fluid and the sperm production. Jarajanya, Jara means old age. So old age is also a contributing factor, which is also mentioned by me in postponing parenthood issue. Dvaj Upghajanya, it means the defective penile function. They are the four main contributing factors described by Ayurveda for the male infertility issue. What are the causative factors of male infertility described by the modern medical science? There are the three main causative factors: impaired sperm production, impaired sperm delivery, impaired sperm transport in the female vagina. This may be caused to the erectile dysfunction by due to the varicocele, by due to diet and lifestyle factor, by the environmental exposure. All these factors contribute to male infertility issue. What are the sign and symptoms or male infertility? When the patient come to you, it is first we have to ask for some of the questions, some of the diagnosis. We have to make a diagnosis of the patient. For the diagnosis, we had to mention some sign of symptoms. So first is inability to get pregnant. Second, difficulty in body and face. It may be due to low testosterone level, due to low male reproductive hormones, erectile disorders, degree ejaculated fluid, low sexual desire. The patient may show one and the combination of one and two, yeah, all of them, as a sign and symptom of the issue. So, what are the tests for male infertility? So, when the patient come to a doctor, the doctor should do the medical and the sexual history of the patient, then the semen analysis, then the endocrine assessment, and last the genetic testing. So, the method of evaluation of male infertility start from semen analysis, which evaluate the sperm count, mortality, especially the sperm morphology. So, my first case is oligospermia. Shukrasya mentioned Ayurveda. So, what is oligospermia? Oligospermia is a pathological term describe a sperm density below the fifth centile in fertile male. Recently, reduced sperm count from 20 to 15 million per ml. Decreased sperm count lead to decreased chance of conceptions and hamper the fertility. Low sperm count, oligospermia, and the poor sperm quality is responsible for approx 90% cases of male infertility issue. Oligospermia is one of the main factors responsible for the male infertility issue. So it is the main factor which is behind the male infertility issue nowadays. The oligospermia may be caused by so many factors, by the low sperm production due to some testes abnormalities, some reproductive abnormality. So, what are the presenting concern of the patient? A 25-year male diagnosed with oligospermia presented in outpatient department of a Panchkarma in Ayurvedic and Unani College and Hospital with a desire of a child. Patient had have a married life of 2 years. Since 2 years, couple tried to conceive but failed, presenting complaints of weakness, erectile dysfunction, and early ejaculation. So, what are the timeline of the cases? The couple unable to conceive since 2 years, weakness since 1.5 years, problem in erection 1.5 year, early ejaculation 1 year. What is the past history of the patient? Patient had no history of diabetes, bronchial asthma, TB, hypertension, and any other systematic disease. The family history, the patient had no family history of diabetes, hypertension, bronchial asthma, TB, and any other systematic disease. Addiction history. Addiction history is always important for a patient diagnosis with male infertility issue because smoking and alcohol both are the contributing factor behind the infertility issue. So, in this case, the patient had no addiction history of smoking, tobacco, and alcohol. Semen analysis report. The color of the semen is whitish, reaction alkaline, volume 0.5 ml, and the content 12 millions. Pus nil. As we show that the oligospermia is mentioned when the sperm count is 15 millions per ml. In this case, it is 12 millions. So it is less than 15 million. So the patient diagnosed with the oligospermia. Diagnostic criteria. Diagnosis was made on the basis of symptoms given in the ancient text of Shukrasya and the modern literature of oligospermia. As defined by the WHO, the low sperm count is less than 15 million sperms per ml. Is called as oligospermia. So oligospermia is compared with Shukrasya and Ayurveda. In Shukrasya, we include both the quality and the as well as the quantity of the semen. But in oligospermia, we especially focus on the quantity. Sorry. So what are the Shukrishya Lakshan? Acharya Charak, Shushruti and Ashtangitya describe so many Lakshan of Shukrishya, which try to compile in there. Durbalta means general debility. Med Vikshana Vedna, pain in the penis and scrotum. Thumayativ, burning sensation is the penis and the urethra. Mathuna Shakti, problematic and not satisfactory coitus. Delay and the blood mixed are no ejaculation, Kleve impotence, Mukha dryness of mouth, Sadhana body ache, Shrama tiredness, and Pandutvam pillar. The patient show one, two, and the more than two Lakshana of Shukrasya. Clinical investigation in this case complete blood count with ESR, liver function test, kidney function test, lipid profile, blood sugar fasting and PP, urine routine and microscopy. All the investigation were under normal range, except SGOT and SGPT, which were mildly increased in this case. General examination and the personal history of the patient. General condition of the patient was good, no deviation vital sign. He had a moderate appetite, normal bladder, bowel habit, regular sleep patterns. He had a sedentary lifestyle, well built and well nourished. As I described in previous slide, that sedentary lifestyle is one of the contributing factors behind the main fertility issue. In this case, maybe the sedentary lifestyle may contribute. He had a BMI 26.6. He is overweight now, means, and the waist circumference 102 centimeter. It is also above the normal range. Patient Prakriti was kapha dominant and had a power sattva. In Ayurveda, the persons are divided on the basis of Prakriti. It is called the concept of individuality. The Vata and Pitta and Kapha, they are the three dominant Prakriti in Ayurveda. And in this case, the patient Prakriti was Kapha. And the Sattva is the patient mental behavior. So patient have a power sattva, has a good mental ability. Assessment criteria in this case, assessment were made by the improvement on the subjective as well as on the objective parameters. Subjective parameters, the main symptom of Shukrasya were assessed, Kilevia, measured by International Index of Erectile Dysfunction. One of the sections of Shukrasya is Kilevia. And for the Kilevia assessment, I especially use International Index of Erectile Dysfunction, which is used for assessment of erectile dysfunction. Objective parameters, serum analysis report, and some of the biomarkers of reproductive health like serum FSH, serum LH, serum testosterone, serum inhibin B. They are the four hormones which contribute for the male reproductive health. So the patient tries so much many treatment since 2 years, but now with the hope in Ayurveda he comes in our OPD. So Ayurveda specially describes so many drugs and special therapeutic procedures to treat the problem of infertility. Acharya Charak also specially mentioned Vasti Karma for the enhancement of Shukradhatu. Vasti Karma is the medicated enema in Ayurveda, which is used for the Vata dosha treatment, and it is also useful for the enhancement of Shukradhatu as well as for the management of Shukradosha. The therapeutic intervention in this case, the patient was admitted and planned for Mustadi Apnavasti, therapeutic enema, for 15 days continuously. Before admission of Vasti, local Abhyanga, oil massage with Balate, and Vashpasveda, steam bath, was done as a Purvrupa. In Ayurveda, before the Panchkarma, the main procedure, the patient was done with the Purvakarma, which is Snehan and Svedana. So in this case, we have Snehan, the patient with the Balatil, and Vashpasveda was done. Mustadi Apnavasti of 600 ml is administered to patient for 15 days. The dose of Mustadi Apnavasti for the medicated enema is 600 ml. Mustadi Apnavasti ingredients. There are total three types of ingredients: Kwaddarve, Kalkadarve, and conventional drug. There are 14 Kwaddarve, which is Nagarmotha, which is Pachan Shukrashodhan, Patha Shukrashodhan especially. Guloy is a Rasayana, Kutki Shukrashodhan, Bala Balle Brihana Ojovardhan, Rasna Balavardhan, Punnava Vrishya, Manjishta Shukrashodhan, Amalta Shukrajanan, खस शुक्रजनन, त्रयमान, Shukra Gokru, Vishyan Pushtiprada. Gokru is also helpful for enhancing the serum testosterone level. And there are so many preparation of Gokru as a single herb in the market, which is used for enhancing the serum testosterone level, for enhancing the male sexual desire, or enhancing the male sexual health. Laghu Panchmul for Balya and Bhrihana. Laghu Panchmul include the five ingredients. Madan Phala for Shukra Kalkadarve Sofa, Vishya, Priyangu, Prajasthapana, Mulethi, Balya, Shukravardan, Indriya, Shukrashodhan, Rasot, Rasayana, Yukrit, Uttejak, Sandhav Lavan, Vrishya, Deepan, Rochan. Conventional drug, cow milk for Vishya, Shukla, and Rasayana. Madhu means honey. Viryavardhak, Medhya, Shrotoshodhak. Cow घी, वृश्चिक शुक्ल रसायन और मांस रस अजामास मतलब बकरे का मांस रस बल्य वीर्यवर्धक. The dose of mustadi apnavasti 600 ml. So all these herbs are mixed together to prepare the mustadi apnavasti. Now I discuss how we prepare the vasti darva. So first we prepare a quat. We take all the quat darva and boil them uh, to uh, to take their main ingredient in a water in a form of decoction. Then we mix the milk in there and prepare a sheer pak. In the other side, we add sandhav laman and madhu along with the gogrit and mix them together in a curd. Then we add masala in there and kalk in there. And at the end, we mix the shirpak darve with that vasti darve and administer in a patient through the anal route. So, what is the effect of therapy on the selective parameter? We prepare a questionnaire from 1 to 3, 1 to 4 for the assessment of therapy on the selective parameter. Higher the score, greater the severity of a disease. Lesser the score, the mildness of the disease show. So durbalta, what is durbalta? Which is weakness and the general debility. Before treatment is 3, after treatment is 1. Panduta, before treatment is 3, after treatment is 3. Agnisat, decreased capability of digestion the food properly. Before treatment is 3, after treatment it is 1. Shrama, tiredness, before treatment is 4, after treatment is 2. Mukhashosha, before treatment is 4, after treatment is 2. Medvikshan Vedna, before treatment is 2, after treatment is 1. Med Dhumayan, मतलब burning sensation in penis and urethra. Before treatment is 3, after treatment is nil. चिरात पर से अल्प रक्त युक्त शुक्र प्रवृत्ति means delay ejaculation, blood means ejaculation या no ejaculation. Before treatment is 2, after treatment is 1. Mathuna Shakti, problematic and not satisfactory coitus. Before treatment is 3, after treatment is 1. Cleavage which is measured by the International Index of Erectile Dysfunction. Before treatment is 10 and after treatment is 22. What is the effect of therapy on the objective parameter? Semen volume before the treatment is 0.5 ml, after the treatment is 2 ml. Total sperm count, which is 12 ml before the treatment, now it is 70 ml, 70 million. Sorry. Effect of therapy on the serum hormones. Serum testosterone level, which is 15.20 before the treatment, it is 382.88 after the treatment. Serum inhibin B, which is 102.29 before treatment, it is now 221.99. Serum FHH level are not changed, but serum LH level are decreased, but it is within the normal range. So, what is the result of the therapy? There is a marked improvement in the sperm count as well as the semen volume after the treatment. The patients show marked improvement in the sign and symptoms of depression and cleavage as per the classics and modern parameters. There was marked improvement in the serum testosterone level and serum inhibin B level. After the mustadi yapna vasti in this case, level of serum LH decreased after the vasti, but there were no adverse effect of the given treatment to the patient. Now, how the hormones play a role in the spermatogenesis? We all know that the hypothalamus is the main gland, which secretes gonadotropin releasing hormone, which act on the anterior pituitary and release FHH and LH. FHH act on the Sertoli cell on the testes and release estrogen and androgen binding protein along with inhibin B level. Inhibin B through its negative feedback control regulate the FHH level. On the other side, LH act on the leading cell and release androgen. Androgen act on the Sertoli cell or enhance the spermatogenesis. So, through the hypothalamus pituitary testis axis, the hormones play a significant role in the spermatogenesis, sperm maturation and development. Discussion: Ayurveda show their gut-brain connection. Their gut is also act as a main organ which have its own brain. In so many studies mentioned that. So, in Ayurveda, Vata dosha is mainly situated in the gut, in the large intestine, small intestine. So, for the Vata dosha, the main treatment is Vasti. And Vata dosha Visheshan is the prime factor behind Shukrasha. Vata dosha, especially the Panvayu, is involved in the ejaculation of semen and maintenance of anatomical and functional integrity of Shukra. And Vasti Karma is the important for the treatment of Vata dosha. Acharya Charak mentioned Vasti Karma as a choice of treatment to treat Shukra Dushti. Vasti is the best remedy for Tidosha treatment according to Ayurveda classics. What is the reason behind Mustadi Apnavasti selection? Acharya Charak mentioned Mustadi Apnavasti as Shukra Mas Baljan. It means it having the capability to enhancing the Shukra Dhatu, semen, Masa Dhatu, muscles, having strengthening the physical activity, physical strength of the body, and also Sadhya Baljanno Rasanam Cheti. It means it having the rejuvenating effect, restorative effect in the body. Acharya Charak, Acharya Shushruta mentioned it as a Rajapnavasti. Rajapnavasti, it means it is specially indicated for the Raja, for the king, and described its quality as a Balya Sanjeevna Vishya. It means it's giving the strength, it aphrodisiac effect, and also give the life to the reproductive system. So it is superior to all the Yapnavasti. Yapnavasti is a special vasti in Ayurveda, which having both the guna of Asthapana and Anvasanavasti. And it is indicated in especially in a person who indulge in a sexual activity, especially in a as a restorative, especially in a for the treatment of eye disorders, especially for the infertility issue, female and males both, or it has no contraindication at all. It is safely used. It has does not depend upon the before food and after food. It is given anytime. So I choose that Mustadi Apnavasti for the treatment in this case. Mustadi Apnavasti can be administered for a longer duration without any adverse effect. The ingredient drug of the Mustadi Apnavasti have predominantly Vathar, Rasayan and Vajikan property. Rasayan means rejuvenating effect and Vajikan means aphrodisiac properties. Conclusion: Mustadi Apnavasti provided significant relief in the symptom of Shukrasha. Vasti may have acted on the systematic symptom of Shukrasha as well as give significant improvement on the seminal parameter like sperm count and the sperm motility. Mustadi Apnavasti gave significant improvement on the serum biomarkers, especially on the serum testosterone level. In any case, there is especially the main focus is the patient perspective. And in my case, the patient perspective are patient told marked improvement in the confidence during sexual intercourse. Patient reported improvement in erection and performance during sexual intercourse. Patient felt better and felt marked improvement in the weakness and increased level of sexual desire now. Overall, patient has satisfactory and better sexual life after the intervention. There are some of my case study published in the national and international journals, which show the Mustadi Apnavasti in the management of Oligospermia case series and the role of Mustadi Apnavasti on serum biomarkers of spermatogenesis, a case study. My second case is the erectile dysfunction, which is mentioned as Clavia in Ayurveda. So, what is ED? Erectile dysfunction, formerly termed impotence, is defined as a failure to conceive and maintain a rigid penile erection suitable for satisfactory sexual intercourse. Erectile dysfunction is a prevalent and multifaceted condition that predominantly affects males beyond 40 years of age. Its prevalence increases with age and the other comorbidity. This condition described as a clavia in Ayurveda classics. So, what age does ET start? At the age of 18 to 29 years, the patient erection is strong. At the age of 30 to 39 years, its erection is average. At the age of 40 to 55 years, its erection is weak. And after the 56 years, the patient failed to maintain the erection. So now, what is the ED contribution in male infertility issue? The severity of ED may increase the risk of male infertility, as we mentioned previously in a slide that the decreased penile function is one of the factors behind the male infertility, and ED is the erectile dysfunction decreased penile function. In fact, 1 in 6 males with infertility may have ED at premature ejaculation. This shows the prevalence of ED nowadays in a population. Ayurveda definition of ED in Clavia. Clavia Mathun Asamarthya means when the patient unable to perform intercourse is Clavia. Clavia iti Dhojanusya when the patient lack strong erection is Clavia. Now what is the sign and symptoms of Clavia? So a person even on having a strong sexual desire to perform the sexual act with a beloved, willing, and cooperative partner, but cannot perform coitus with her due to lack of its penile erection and lack of penile rigidity. Even if he managed to have an erection, his anxiety will cause attack of dyspnea, difficulty doing breathing, perspiration, excessive sweating, and to have an sex, his attempt to have sex with this will result in a tiredness, frustration, and due to which his attempt will end in a failure. So, what are the other symptoms associated with erectile dysfunction? Immediate softening of the penile erection after the seminal emission, absence of morning erections, imperfect and partial erection for a short time, and subsides before the male's main sexual act, premature and early ejaculation. What are the causes of AD? Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and the blood vessels. So, there are the physical causes and as well as the psychological causes, and in some cases, the combination of both. How we make a diagnosis of erectile dysfunction? So, first, hormone profile, a blood test to measure the level of male hormones, especially serum testosterone level, serum FHS, serum LH level. Complete blood count to check for the heart disease, diabetes, infection, and any other abnormality causing the symptoms. Urine analysis to check for the diabetes and any other systematic disease and infection. Rectal examination to assess the changes in prostate gland. Ultrasound to get images of the penis and the prostate gland. Psychological examination to assess the psychological disorders, which is the main contributing factor nowadays for the erectile dysfunction. Nocturnal penile erection. During sleep to diagnose the ED. All know that the sleep have two stages, REM sleep and non-REM sleep. During the REM sleep, there is a normal occurrence of penile erection. If the patient unable to get the penile erection during the REM sleep, then he is diagnosed as a patient of ED. Presenting concern of a patient. The patient is 37 years old, 5 years of his married life, having the unsatisfactory sexual life, unable to maintain proper ejaculation, excessive perspiration during sexual act, having the intense sexual desire but unable to maintain erection. Timeline of the case is erectile dysfunction 1 year, early ejaculation 6 months. Past history: no history of diabetes, asthma, TB, hypertension, and any other systematic disease. Family history: father and mother both having the history of diabetes. The patient are also more vulnerable for the diabetes. Addiction history: addiction history of smoking regularly and alcohol occasionally, which is also a contributing factor behind the infertility issue. Diagnostic criteria: diagnosis was made on the basis of symptoms given in the text of Clevia. Clinical investigation: complete blood count with ESR, RBS, random blood sugar, serum testosterone level, thyroid profile, serum FHH, LH, prolactin level, LFT, KFT, urine analysis in this case. All the tests were normal, except blood sugar level was borderline. General examination: personal history of the patient. Patient had a poor appetite, normal bladder, regular bowel habit, and disturbed sleep pattern. Sleep is also a contributing factor behind the so many disorders. As sleep regulate the reproductive health, regulate the immunity, our digestive health, our growth and development. All the systems are regulated and stimulated by this normal sleep. So, disturbed sleep pattern also contribute to the infertility, erectile dysfunction, and oligospermia too. There are so many studies published which show that the sleep deprivation lead to decreased semen quality and quantity. Patient had a sedentary lifestyle but had a weak build, having a BMI of 20.4. Blood pressure was toward the higher side. Prakriti was Vata dominant. Assessment criteria, especially the selective parameter, Kilevia, by the International Index of Erectile Dysfunction. What is International Index of Erectile Dysfunction? So, psychosexual background and the partner relationship both are considered important factor in the presentation of male sexual dysfunction. The respondent were asked to consider the impact of the erection problem had on their sexual life in the past 4 weeks. Sexual activity include the intercourse, foreplay, and the masturbation. A score of 0 to 5 are awarded to each of the 15 questions. Then the score are interpreted in the view of 5 domains. There are the 5 domains of the International Index of Erectile Dysfunction. Domain A, erectile function, which having the maximum score of 30. Domain B, orgasmic function, having the maximum score of 10. Domain C, sexual desire, having the maximum score of 10. Domain D, intercourse satisfaction, having the maximum score of 15. Domain E, overall satisfaction of a patient, having the maximum score of 10. So how we assess the ED severity through the International Index of Erectile Dysfunction? If the score is from 5 to 7, it is the severe, 8 to 11 moderate, 12 to 16 mild to moderate, 17 to 21 mild, 22 to 25 no ED. Therapeutic intervention in this case: Chan 2 tablet twice a daily after food for 30 days. Kapi Kachi Chun, 3 grams twice daily with milk after the food for 30 days. Ashwagandha Leham, 3 grams twice daily after food for 30 days. Bhingraj Asap, 20 ml twice daily after food for 30 days. Effect of therapy on the safety parameters. The score, which is previously 14, it is now 26. This shows the improvement in the International Index of Erectile Dysfunction after the treatment. Result: there were improvement in Kilevia as per the classes and the modern parameters. There were no adverse side effect of the given treatment to the patient. Now, why we choose this treatment? Discussion on the Chan probability. Chan probability is a Ayurvedic preparation in which Chandra means moon, Prabha means glow. It is consisted of 37 ingredients total. Chan probability mostly used in managing the urinary complications. So many doctors prescribe it for the urine complaints. Chanpravati also be used for managing the ED due to its aphrodisiac property, as well as it also maintain an erection during sexual activity. Swallowing Chanpravati along with milk and water also help to manage the level of blood sugar level by increasing the insulin secretion due to its antidiabetic activity. It is known to have a balya, means give strength physically and mentally, vishya, aphrodisiac, and rasan, rejuvenating property, and help increasing the strength of a body, overall strength of the reproductive system. Discussion of Kapi Kachi Chun. Kapi Kachi Chun is used to treat and maintain a healthy nervous system. It is the best single herb which is used for maintaining the vata dosha as well as for enhancing the quality as well as the quantity of shukra dhatu. This powder also increases the level of serum testosterone level and the sperm count in males. It also reduces the symptom of stress and anxiety. Acharya Bhav Prakash mentioned it as a Vajikram Pram, means it is the best aphrodisiac medicine. Discussion of Ashwagandha Leham. Ashwagandha Leham, having the six ingredient, is used for the treatment of neuromuscular condition. It increases physical strength, vitality, vigor, stamina, and the physical endurance level. It is also be used for the uh, individual who regularly goes to the gym. It is best hand medicine for the proteins, best medicine for giving the physical and the mental strength of the body. Generally, it is used for the emaciation, underweight person, physical weakness, debility in old age, oligospermia, and the impotence. It is beneficial for the insomnia, anxiety, and the stress disorder. It is the best medicine for stress-related disorder too. Ashwagandha leham mainly act on the vata dosha and likely to increase the kapha dosha. Discussion of Bhringraj also. As we all know, Bhringraj is the medicine which is used commonly for the hairs. But in Ayurveda, a single herb may be used in so many diseases, in so many references are given in a classic for its therapeutic approach. So Bhringraj also having the nine ingredient known for known as a potent restorative tonic with a strong detoxifying and appetizing effect. It improves the appetizing acting on the stomach and liver. It improves the liver function and increase the metabolic rate. Bringraj is the best herb for the yikrit, for the liver. It provides nourishment and strength to the body. It improves the libido and increase the stamina and overall strength of the body. Its action mainly on the vata dosha and kapha dosha. It is having the potent spermatogenic and aphrodisiac properties that are very helpful for treating the erectile dysfunction, early ejaculation, asthenospermia, teratospermia, oligospermia, hypospermia, and enhance the spermatogenesis, sperm production. Male hormones like testosterone, luteinizing hormones are produced more effectively by the herbs primrose because it contains the natural antioxidant, effectively promoting the blood flow to the penile tissue. It causes an erection. Being a natural adaptogen, it also aids in lowering the anxiety, mental stress, and boosts the hormone that increase the libido. It helps in improving the virility and stamina in male. Conclusion: the combination of the said formulation help to treat the erectile dysfunction effectively. This combination help in treating the psychological region of ED also by its adaptogenic effects. Patient perspective: patient was satisfied with the improvement in erection and now able to perform a better sexual life. It's my one of the publication report of me in erectile dysfunction. So Gautam Buddha also said that every human being is the author of his own health and disease. So adopt Ayurveda, the way of life, for healthy and a happy life. Ayurveda specially mentioned two objectives. So Sastya Swasthya Lakshanam means to maintain the health of a healthy and Atrusya Vikar Prashanancha. It means to treat the diseased person. So The prime objective of Ayurveda to maintain the health, to maintain the health of all the system. So Ayurveda especially mentions some of the herb, some of the formulation for the reproductive health of a male and female. Thank you.
Thank you so much, sir, for taking out your valuable time and sharing your knowledge on this, sir. I definitely think this session knowledge is going to help all the participants who have joined this session. Sir, we have received some questions from the participant. With all your permission, shall we take these questions?
Yes,
Hello.
yes,
Yes, the first
yes.
question is from Dr. Anubhav, and he is asking what are the key signs and symptoms considered and how they have related to the dohas like Vata, Pitta, Kapha.
Ayurveda describe three main dosha, Vata, Pitta, and Kapha. In the Vata person, the Vata is so much enhanced. Then the person having the symptom of decreased erection, decrease sperm count, decrease maintenance of erection, sexual desire also decrease in that case. And sexual weakness is the main disease of Vata dosha. So in sexual disorder, mainly the Vata dosha is involved. So we have to treat the Vata dosha especially in this case.
Thank you so much for answering, sir. One of the audience is asking Mr. Raja, which herbs are beneficial for increasing sperm motility?
There are so many preparation mentioned in Ayurveda. Ashwagandha, Bhringraj, Kokshur. These herbs are used for enhancing the sperm quality and as well as the quantity. There is one especially herbs I use in my treatment, Kapikachu Chon, which enhance the semen quality and the quality. Or so many preparation like Virya Shodhanvati, which enhancing the sperm motility.
Thank you so much, sir. There is one feedback from Dr. Yash. He's written very good, informative session and important that taking highlights on Ayurveda. And I hope that he has really enjoyed this session, sir. And as I can see, sir, there is
Thank
no
you.
more questions, sir. With all your permission, shall we conclude this session for today?
Yeah, yeah, yeah. Thank you.
Okay,
Thank
sir. And
you,
we would like to see you in
Prajay.
future also with different topics,
Thank
sir.
you.
Have a great day,
Take care.
sir.
Thank
Thank
you.
you.
Thank you.